Coming to the female reproductive system, in this lecture we will see about various objectives. This female reproductive system, we have to study even the little bit of fertilization process also. Okay, so let's start. So coming to learning objectives, we will study about the location, structure and functions of each part of the female reproductive system. Outline the event of oogenesis, that is formation of ovum from the ovary. Okay, then describe various phases of ovarian and menstrual cycle. So menstrual cycle, there are 3 phases. So in that 3 phases there will be changes in ovaries also, that we will understand. Then hormonal control mechanism involved in functions of ovary and menstrual cycle. This is also a major role in female, you need to understand. Then the physiological effects of estrogen and progesterone. Okay, so coming to the reproductive system of female, it is more complex than male in terms of function. Okay, why it is complex? Because the female reproductive importance starts from menarche and ends in menopause. Menarche is initiation of menstrual cycle. Menopause is cessation of menstrual cycle. Okay, so in simple term, you say the menarche is puberty and menopause is cessation of menstrual cycle. So in this, if you see, let me explain that in a separate paper. The female menarche and it starts with menopause. Menarche is nothing but the puberty. Menarche is nothing but the puberty. Okay, puberty, that is the age range is around 9 to 13. Okay, whereas menopause is menarche is a time where the first menstrual cycle starts in female. Okay, so menstrual cycle is it is something like preparing the uterus to receive the child. So the female reproductive starts from the reproductive age starts from the menarche, which is around 19 to 30, and menopause is complete cessation, stoppage of menstrual cycle. Okay, this takes place, that is cessation of menstrual cycle of at age range around 45 to 50. Okay, so in this there are 3 changes taking place. Okay, physical changes, then physiological changes, and psychological changes. What is this physical change? Physical change is in menarche, what happens? There will be growth of pubic hairs, axillary hairs, then development of breast mass. Okay, all these are the physical change, and even the shyness for the, thinness, this smoothness for the skin. Okay, due to accumulation of more subcutaneous fat. Okay, so whereas the physiological changes menarche is the hormonal changes. There will be first initiation of menstrual cycle. There will be for the follicle stimulating hormone will be released, and the luteinizing hormone released in the pituitary, and that will lead to secretion of estrogen and progesterone in the ovary. These are all physiological changes. Psychological changes will be, there will be shyness. Okay, for females who after puberty they tend to feel shy. Then withdrawal symptoms will be there. Okay, these are all the psychological changes. Whereas in menopause, The physical change will be menopause. Actually, it's the age where this menstrual cycle stops. The physical change will be the breast mass will shrink, the subcutaneous fat in the under the skin will reduce, so the skin will shrink. Okay, there will be loss of pubic and axillary hairs. These are all the physical changes. Then physiological changes is there will be less production of estrogen and progesterone hormone, and the menstrual cycle will stop. Okay, so these are all the physiological changes. Psychological changes will be suicidal tendency will be there, irritation will be there, then stress will be there. So these are all the psychological changes. So female who are in the perimenopausal age, that is around the menopausal age, they will have a lot of anger symptoms. There are more divorce cases that comes to court in this age, and mothers, they try to show their anger by breaking things in this age group. Okay, so you have to understand it is perimenopausal symptoms. These are all the psychological changes in menopause. Okay, so likewise, you have in female reproductive system, you have to study about ovaries. Ovary is a female gonad. Ovary is a female gonad, and this female gonad is mainly responsible for producing estrogen and progesterone and ovum. So it is acting like a heterocrine gland. In male, the testis is acting like a heterocrine, that is endocrine and exocrine. Exocrine function is protection of sperm cells, endocrine function is protection of testosterone. Likewise, in the ovary, endocrine function is protection of progesterone and estrogen, and exocrine function is protection of ovum. Okay, so coming to the ovaries, they are the primary reproductive organ, produces the ovum. Okay, and also produces the sex hormone, that is estrogen and progesterone. Okay, and apart from this, there are duct system which consists of two uterine tubes. We call it as fallopian tubes, one uterus, which is where the baby will grow, and the vaginal cavity, okay, which will collect the semen and conduct the semen towards the fallopian tube. Okay, so this is a cut section you are seeing. This is os pubis joint. Better I show this in the 3D model. So this is a female pelvis. Female pelvis, it has lots of difference between male and female. Okay, male pelvis is just triangular. Female pelvis is broad because it has to accommodate the baby passage, fetal passage. Okay, so if you see underneath the pelvis, okay, if you see underneath the pelvis, this is a pelvic outlet. Okay, and this is a pelvic inlet. This is a pelvic inlet, that is from the iliopectineal line and the sacral ala. Okay, so this is the pelvic outlet. So if you look at the muscles around in the inferior aspect of the pelvis, this is a pelvic diaphragm. This is a pelvic diaphragm. You have these flat muscles that is acting like a pelvic diaphragm, the levator ani and the coccygeus muscle. These are the levator ani and the coccygeus muscle. These two muscle forms the pelvic diaphragm. Okay, so as I told you before, the inferior aspect of the pelvis, we divide it into triangles. So you have to draw one imaginary line from the ischial spine to the os pubis, likewise here, and to the tip of the coccyx to the ischial spine. Now draw one imaginary line in the transverse plane. So when you draw, this becomes one triangle. This triangle is called as a urogenital triangle, and this triangle is called as the anal triangle. So the urogenital triangle, it gives place for opening of this vaginal cavity and the urethra separately. Okay, so if you look at the reproductive organs here, this is a birth canal, the vaginal cavity, and this is the passage for urinary output. and these are the other copulatory organs. Okay, now I will show you inside the pelvis arrangement of female reproductive organs inside the pelvis. For that I will remove one side pelvic bone and the femur, so that it is clearly visible. Okay, now what you see here is these three pelvic organs. These are all the organs of pelvis, organs present inside the pelvis. What are the organs present inside the pelvis? This urinary bladder, uterus, then this digestive tract, that is the rectum, and posterior to that you have the sacral plexus nerves. You have all the nerves of the sacral plexus. You see, these are all the nerves of the sacral plexus. These are, and also you have two ovary. This ovary is equal to testis in the male. So this testis doesn't stay inside the pelvic cavity. It comes to the superficial and deep inguinal ring and comes to the scrotal sac. Okay, so this passage becomes the round ligament for the female. So that's why the inguinal hernia in female is very rare. The inguinal hernia in female is very rare because this passage is not open, it's closed. Okay, because the spermatic cord in like male is not entering through the in the female. Okay, so now when you see this anatomy, what you have to understand is, just after the os pubis joint you have the urinary bladder. Okay, after this urinary bladder you have the uterus and the vaginal cavity. You see, this uterus is bent anteriorly. This is called as anteverted uterus. Okay, if this uterus is bent posteriorly, we call it as retroverted uterus. So there will be infertility problems with the retroverted uterus. The female doesn't conceive the child properly if the uterus is bent posteriorly. So whenever the female goes to clinic telling that she is not having child, you have to do the ultrasound and see what is the position of the uterus. It is bent anteriorly or posteriorly. So this anteverted uterus is normal, and underneath you have the vaginal cavity. This vaginal cavity is the birth canal. It is the birth canal. The vaginal cavity is the birth canal. Okay, then after this vagina and the uterus, you have this rectum. Okay, this rectum is the canal for the fecal matter. This urinary bladder will bring this ureter will bring the urine to the urinary bladder. Okay, so this is the arrangement. Why you have to know the arrangement? Because the cervical cancer is common in female. This is a uterine cervix. This is the cervix of the uterus. Okay, origin of cancer is common in female. Okay, so uterine cancer is common. So in that case, what happens? If there is cancer growth here, this will erode the tissues here or here. Okay, anteriorly or posteriorly. So this erosion will lead to formation of abnormal connection. If the bladder is having abnormal connection with this vaginal wall, the urine will pass out through the birth canal. Okay, that's called as vesicovaginal fistula. Okay, if the vagina is having communication with the rectum, then the flatus and the fecal matter will pass through the birth canal. So that's called as rectovaginal fistula. So this is what happens. When there is cancer origin in this cervix. Okay, so in chronic stages, this kind of infiltration starts and abnormal. These are the complications in cancer. Okay, these are the complications in cancer. So when you see from the superior aspect, you have this peritoneal sac. Okay, I will show you. Okay, this is a peritoneal sac. Okay, wait. You see now here is the pelvic cavity, and here you have the abdomen where there is peritoneal sac. This peritoneal sac is just kept on the uterus and the bladder. It is just kept on the uterus and the bladder. So if you see closely here, this is the urinary bladder. Okay, this is the urinary this is the urinary bladder. This is the urinary bladder. I will hide these muscles for your clear understanding. Yeah, this is the urinary bladder, and this is the uterus, and this is the vaginal cavity. This is the vaginal cavity. Okay, and this is the rectum. Okay, so all these structures are closed by this peritoneal sac. If you see the border of the peritoneal sac from the superior level, if you see inside, the sac is kept just in the pelvic cavity, that is covering the uterus, then covering the bladder here. If you see in the side, see, this is the uterine tube. This is a uterine tube that is covered by this female pelvis. Then this is the uterine cavity that is also covered by this female this peritoneal sac, and this is a bladder. So that means what? This peritoneal sac is covering the whole uterus, and that fold is coming between the bladder and the uterine wall. Okay, this pouch is called as a Douglas pouch. This pouch is called as Douglas pouch. Okay, likewise between this rectum and the uterus, this peritoneal sac comes and folds like this. So this fold is called as the recto. This fold is this fold is called as a mesometrium. Okay, from the top you can see. Okay, from the top you can see. What I am telling is, this place is very important, because if you see, this is the ovary, and this is the fallopian tube. I will remove this. This is a fallopian tube. The endometrial tissues comes through this tube and pours around the ovary, and this fluid comes and collects here. Okay, around the uterine os. Okay, so what happens? This condition is called as endometriosis. This condition is called as endometriosis, where the female feel lot of cramps during menstrual cycle. Okay, so this is the vesicovaginal pouch. It's also called as the pouch of Douglas. Sometimes when there is pus collection, there will be pus collection here or fluid collection. So when you do PV examination, you put the finger here and touch this area. If this area is warm, you insert a needle and try to aspirate the fluid. It can be ordinary fluid or it can be abscess. Okay, so that's the importance of this Douglas pouch. That's the importance of this Douglas pouch. Okay, so let's go back. I will remove. Okay, so these are the organs of pelvis. These are the organs of pelvis. These are the organs of pelvis. Let's go back. If you see here, as I told you, this is an anterior view and this is a lateral view. The bladder anteriorly, the urethra is opening separately, and the vaginal cavity posterior to the bladder, and it's opening separately, and the anal canal, that's opening separately. Okay, so so coming to the ovary, and one more important thing that you have to understand is the muscle anatomy here. Okay, now imagine the female is going to have delivery. Okay, the child has to pass out through this birth canal. Okay, sometimes the head circumference may be large, sometimes the head circumference may be large for the female. So that time what happens, this the relaxin that is secreted, the hormone relaxin that is secreted during time of delivery will relax all these muscles. Sometimes the head circumference will be big. So in that case, what you have to do is you have to do emergency episiotomy. If you don't do this, what happens? If the head circumference is too much, what happens? It can damage this round sphincter muscles around. These are all the round sphincter muscles here and around urethra. Okay, suppose if the tear happens in this side, what happens? It will damage this round external sphincter muscles of the urethra, and the female will suffer with urinary incontinence for the whole life. Okay, or that's called as it can weaken the external urethral sphincter and it can lead to stress urinary incontinence. Okay, when they cough, urine will leak. When they lift heavy weight, the urine will leak. Okay, this leads to unnecessary infection. Suppose if the tear happens in this direction, it can damage the circular muscles around the anus and it can lead to fecal incontinence. So what you have to do, you have to take a knife and you have to take a scissor and you have to cut in this direction or in this direction for episiotomy. Okay, this is procedure is called as episiotomy. So thereby what you do, you preserve this round circular muscle around the anus as well as the round circular muscle around the urethra and allow the baby to pass out easily. Later you can suture these muscles. You can make a suture of these muscles and close the repair. Okay, so this has to be done on an emergency basis. This has to be done on an emergency basis in the labor room. Okay, so when you work in clinics, you will see all these situations. Okay, so coming to the ovary, ovary, as I told you, it is present in the pelvic cavity. The ovary is present in the pelvic cavity here. It is safely placed inside the pelvic cavity, okay, which is having rich vascular supply. It is safely placed inside the pelvic cavity. It is having the rich vascular supply. So what happens? This ovary, it has different stages of ovum. I tell you, every 28 days one ovum is released in each ovary. That means what? There are around 300 to 400 ovarian follicles. Okay, like this one, primordial follicles. But every month, every 28 days, one will start to mature. Okay, so the maturing ovum is called as primary follicle. Then it is taking as the name as primordial follicles, then secondary follicle, and then the ovum. Okay, so in this it is given as primary follicle, then primary oocyte. Oocyte means ovum cell. Okay, then this is the secondary oocyte. If you see here, this is a ovum and there are fluid around it. It's called a follicular fluid. Okay, then this ovum keeps maturing in that, exactly on the 14th day. This fluid will rupture. And this ovum will come out on the 14th day only. Okay, from 14th day to 24th day, menstrual cycle, you have to understand 1 to 10 is the phase 1, 10 to 14 is phase 2, and sorry, not 10 to 24, that is 14. I will explain that, don't worry. Then 25, 26, 27, 28 is menstrual phase, the 4 days where the menstrual flow will be present. Okay, so exactly on the 14th day, this ovum will come out, and this follicle will take the name as the corpus luteum. Okay, this corpus luteum will produce progesterone. That's why in second phase of the menstrual cycle, the progesterone level will be high. Okay, then this ovum will go to the fallopian tube, eagerly waiting to meet the sperm cells. Okay, now so this is how the ovum is developing in each ovary. Okay, so as I told you, there are different stages. Primordial follicles, it's squamous like follicle cells surrounding the oocyte. Then primary follicle is cuboidal columnar follicle cells surrounding the oocyte. Secondary follicle, 2 or more layer of granulosa layer. Okay, the vesicular follicle contains the fluid space between the granulosa cells. coalesces and to form a central antrum. Okay, now when you look at the graphene follicles, okay, I will also show other picture and explain. Okay, fluid filled antrum forms follicle bulges from ovary and surface. Ovulation is ejection of oocyte from the ripening follicle. The remaining part becomes a corpus luteum and starts to develop the start to secrete the follicle progesterone. Okay, so this is the picture you can see. So if you see closely, this is the primary follicles. Okay, so this primary follicle will start to mature. One primary follicle will start to mature. So that's a central cell, that's the oocyte, ovum. Okay, then it keeps maturing and on 14th day this oocyte, that is the ovum, is pushed out. It will burst and it will push the ovum out. Then this thing will change into yellow color, and this yellow color substance is called as a corpus luteum that secretes the progesterone. This ovum is having rich amount of blood supply. Okay, this ovary is having rich amount of blood supply. Okay, now let me show you some other picture and explain. I don't want to confuse you, but I want to go along with the slide. Okay, okay, so I will show one picture and explain so that you will understand the hormonal role also. In the menstrual cycle, if you see in the menstrual cycle, this menstrual cycle has total 28 days. Sorry, I am not good in drawing. So first 10 days is phase 1, then next 14 days, that is from 11 to 24, it is phase 2, and this last 4 days is phase 3. Okay, phase 1, phase 2, phase 3. Okay, phase 1, phase 2 and phase 3. So this phase 1, what happens here, this phase 1 is called as the proliferative phase. Then phase 2 is called as secretory phase. Phase 3 is called as menstrual phase. Phase 3 is called as menstrual phase. Okay, phase 1 is also called as estrogen phase. Phase 2 is also called as progesterone phase. Phase 3 is menstrual phase. Okay, why it is called as estrogen phase? Because more amount of estrogen hormone will be secreted. Why it is called as progesterone phase? Because more amount of progesterone will be secreted. Menstrual phase, you know. Okay, now what is happening in this 28 days inside the female uterus? This is what you have to understand in menstrual cycle. Okay, so the first 10 days after menstrual cycle is finished, day 1 starts. So in the first 10 days, the uterus will start to prepare to receive the child. Uterus will start to prepare to receive child. For that, hormone is very important. So what hormones? So if you go to the pituitary gland, you know what? This follicle stimulating hormone and the luteinizing hormone will be gradually released in the pituitary gland in the first 10 days. In the first 10 days, the follicle stimulating hormone and the luteinizing hormone will be released. This follicle stimulating hormone and luteinizing hormone will go to Yes, follicle stimulating hormone, luteinizing hormone will go to the this ovary and stimulate this corpus luteum. Sorry, this ovarian follicle. And in the first day, the ovarian follicle will start to gradually mature. In first 10 days, the ovarian follicle is primordial, then Graphian, like that it takes the different name. It starts to mature gradually, and on the 14th day the ovulation starts. That's why in the menstrual calendar the 14th day is called as a women's day. The ovum comes out to the fallopian tube and it is ready for fertilization. Okay, so during that time the ovarian follicle will secrete estrogen. That's why first 10 days is called as estrogen phase. Okay, so what happens in this ovary, in the uterus? What happens in the uterus during this time? We have to understand. Okay, so this is the first day. Put this 4 day in the back. Take this is the first day. What happens? The mucus starts to deposit inside the uterine cavity. The mucus starts to deposit inside the uterine cavity, and gradually the thickness increases and there will be formation of these spiral arteries inside the endometrium. Okay, so on the 10th day the uterus is completely ready, but the ovulation is taking place on 14th day. The ovulation is taking place on the 14th day. So that's why first 10 days after menstrual cycle is called as free period. If a female is having sex without any protection, she will not have any chance to conceive the child. Okay, but on the 10th day till 24th day, the ovum is roaming in the fallopian tube area. From the right ovary or the left ovary, it is roaming in the fallopian tube area, and the uterus is also ready. There will be more amount of mucus formation and there will be more amount of spiral arteries that is ready to receive the fertilized zygote. So the sperm cell plus ovum cell gives the zygote, isn't it? So it is ready. I will show you one video about the fertilization. You will be able to understand. Okay, so it is ready to receive the fertilized zygote. So the uterus is ready. In case if the fertilization doesn't take place, so what happens? The uterus will wait for 24th day, 25, 26, 27, 28. It starts to break. It starts to break and flow out as a menstrual cycle. Flow out as a menstrual. So this is the changes that is taking place every 28 days inside the female uterus. This is the changes that is taking place every 28 days inside the female uterus. So first 10 days there is no chance of conception. 10th to 24th day there is that's called as a progesterone phase or the secretory phase. In this case, there will be more progesterone. In first 10 days there will be more estrogen. Okay, so that's why the secretory phase is called as the progesterone phase. In the progesterone phase there are chances of conception. This progesterone is secreted by the corpus luteum. Corpus luteum is, once the ovum comes out of this follicle, it changes into yellow color and takes the name as corpus luteum and start to secrete progesterone. So now itself let me show what is happening inside the uterus for fertilization. Okay, so and this ovulation is taking place. This ovulation is taking place on the 14th day, and it comes to the fallopian tube. In the fallopian tube there are this ciliated epithelium. I will show you the hair. Cilia means hair, isn't it? A small video of how the fertilization is taking place in the fallopian tube, and how the development of embryo is taking place, how it is implanting in the uterus. You will see here. Just watch the video carefully. This is the fallopian tube where there is hair follicles. Okay, it's called a ciliated epithelium. So in this the sperm cells are running to fuse with the ovary. Once they find the ovum, they just go and try to penetrate. All the sperm cells are swimming and trying to penetrate. Okay, once it penetrates, only one sperm cell will be successful to penetrate the ovum layer. Okay, so the successful sperm, what happens, the head will try to penetrate the inside the ovum. So this head will have acrosome, so they will release the acrosome fluid, and that will weaken the ovum layer, and now this is how the sperm cell goes inside. Once it goes inside, the tail will cut off, and within fraction of second the full ovum will freeze, and it will not allow any sperm cell to go inside. Okay, now what happens after it goes inside, it goes with the nucleus. So you see, this is how the sperm cell comes inside the ovum, causing different penetrating different layer of ovum cell. And once the sperm cell goes inside, the tail will cut off, and the nucleus will go and fuse with the ovum nucleus. It becomes diploid nucleus. Now this is the nucleus of the ovum, this is nucleus of the sperm. So they join together to form the diploid nuclei. Okay, so this is the initiation of starting of life. Once diploid nuclei comes, then the cell starts to multiply. So during the multiplication process, when the cell multiply into 16 cell, it's called as morula stage. Okay, so when this cell during that time, what happens, this embryo, this zygote will keep moving towards uterus. This hair follicles, the hair follicles will keep pushing the zygote towards the uterus. If this hair follicle is not functioning, then the zygote stays in the uterine tube, and the fetus will develop in the uterine tube, and it will rupture within a week. So that's called as tubal pregnancy. Okay, so now when you see this cell multiplication will be gradually taking place, plus this the zygote will keep moving towards the uterus. Okay, so when it comes to uterus, the cell will multiply to 64. This is the uterine cavity. The zygote is falling in the uterine cavity, and now as you know, there are more amount of mucus, the uterus is ready. So this will come and release that blastocyst stage, zygote into the uterine mucus, and this will go and settle inside the mucus. In the mucus there will be different stages. Okay, so by this time the cell will multiply to 64 times. Okay, so the outer layer, there is outer cell mass and inner cell mass, you will learn in embryology. So this will start to form the neural tube. This is a neural tube that is formed. Okay, in the first beginning stage, the neural tube will be formed, and then the heart tubules will start to form here in the third week. Okay, so this is the heart tube, that is heart vessel that is starting to beat in the third week of intrauterine life. Thereby the neural tube is also developing. Okay, so now gradually this embryo starts to develop. This embryo, it starts to develop. You see, there will be formation of face. I will show you another video, you will know the different stages. Okay, so this is how the limb bud is developing. This tail is called as a cloaca. Okay, so this is the branchial arches, and this is the head, the cerebrum and the cerebellum. This complete structure is called as the neural tube. This complete structure is called as the neural tube. So gradually this development of this baby is growing. So I will show you another video what different stages of development. Okay, the vertebral column is formed. Okay, the limb bud is present, and this cloaca will shrink. Okay, and thereby this is how the baby keeps, and the cerebrum will start to develop. The cerebrum will start to develop. This is the lower limb bud that is growing. Okay, and the eye formation will be present in the branchial arches. Okay, so and the neck structures are aorta, all these things are, there are 6 branchial arches you have seen. Okay, so this is how the baby grows, and it will be ready for delivery. Okay, so during this time there will be multiplication of neurons. There will be multiplication of neurons, and the baby starts to grow till 9 months. Okay, so I will show you another video for okay, so this is the releasing of ovum from the ovary. Okay, you can see here, this will come to the fallopian tube, and then as I told you, these hair follicles are oscillating and pushing the ovum towards the uterus. Fertilization can take place in the uterus also. Mostly the fertilization is taking place in the fallopian tube only. So there you can see the sperm cells that is swimming in the sperm cell. 1 billion sperm cells are released in single ejaculation, and this will try to penetrate the ovum, but only one sperm cell will be successful. Okay, so this is how the sperm cell is. Once it is entering, immediately the outer layer will freeze and it will not allow the other. So this zygote will come and implant in the uterus. Okay, that is a fertilized egg, and from here the cell multiplication starts. This is called as cleavage. Okay, so 2 become 4, 4 become 6, 8, 8 become 16. So this is how the neural tube is formed. Okay, and the heart, in the 5th week the heart circulatory system starts to work, and these are the branchial arches where the nose, mouth, ears will develop. In 6th week the intestine and brain also begins to develop in 6th week. Okay, then in 9th week the reproductive organs begin to form. Okay, so from 9th week, if the sex also can be determined. So in 10th week the smell will start to develop, smell function will start to develop, and in 11th week bones will begin. See, first 3 months, that is first 12 weeks, we call it as first trimester, where the organogenesis, formations of organs will be present. Okay, then all the organs will be formed in the first 3 months, not 3 weeks, first 3 months. First 3 months is called as first trimester. All the organs will be formed, but in the second and third trimester the organ starts to mature. Okay, that is important. Okay, after 12 weeks, so that is why taking of medicines, exposure to radiations in the first trimester should be avoided, because it can lead to congenital anomaly, congenital defect. Okay, then 16th week the neck muscles, backbone start to grow. Okay, then baby starts to kick and roll in the 18th week. Okay, you can feel the baby kicks. Okay, in the uterus. And 30th week the brain start to develop too much. There will be rapid multiplication of cerebrum, and there will be formation of sulcus and gyrus in cerebrum. So in 35th week the baby can recognize the mother's voice. Okay, and the hair, nails start to grow, skull bones will not be fused in the intrauterine life. Okay, so this is 40 weeks of pregnancy. So at 40th week we call it as full term. So the pregnancy will be for 40 weeks and 6 days. So baby will be delivered, and this umbilical cord will be cut. This is placenta and this is the umbilical cord. Once the umbilical cord is cut, then immediately the baby starts to breathe. Okay, immediately the baby will start to breathe. So this is how the birth process is taking place. Okay, this is how the birth continue with the duct system in the next session. Okay.